Thank you so much to HART for letting me be here today. I greatly appreciate this opportunity to get to share more about our HIV project at Inland County's Legal Services with you today. Before I get started, like Stephen mentioned, we do actually have our first up-and-coming advice and counsel clinic with the HIV project at Fenwick and West. This is if you qualify for ICLS Legal Services, then you would be able to participate in this clinic for free. You get to sit down with a lawyer for about an hour over Zoom. This will happen between May 12th and May 22nd. There are some key areas that we're just, as this is our first clinic, to kind of focus our attention on. Some of these areas include questions around housing, healthcare services and access, medical data privacy, discrimination, and those kinds of concerns. So if you are interested, if you know folks who are interested, I have a few extra flyers here. Like Stephen mentioned, I believe it's also been shared on your Facebook groups. So.
And also, it went out in the mail to everybody's on
Yes, so you can either reach out to Stephen and Stephen can connect you with me. You're welcome to contact me directly as well, and I'm happy to share my email address if you have any interest or know folks who may be interested. There also on the flyer is a link that will take you directly to an interest form, where once you submit all of that information, either myself or someone on our team will reach out to you and start going through the process to get you signed up for this. Well, thank you so much again for letting me take time to be here today. Is this better? Okay. All right.
Yeah, we can just surround. And that way, the sound's going in there. So.
Okay, perfect.
In this zone.
All right. Well, if anyone at any point cannot hear me, please let me know, and I'm happy to adjust, and we'll go from there. Thank you so much again for the opportunity to be here today. I greatly appreciate it. Like I mentioned, my name is Levi Colonna-Bevis. I am an Equal Justice Works Fellow with Inland County's Legal Services, sponsored by Fenwick and West. And my project for the next 2 years is focused on building out an HIV project at Inland County's Legal Services. So our primary goal with this project, and we'll talk in depth a little bit more about what kind of launched this project, what we're hoping to do with it, and what services we're able to offer both at ICLS and directly with the HIV project. But we are a community-based organization, and part of that is getting out to folks like HART and providing legislative updates like these. I do just want to share, first before we get there, here's my email address as well. If you have any questions, concerns, thoughts, if you know folks who are in need of services, please feel free to reach out to me directly. You're always welcome to. Like I mentioned, we're in the process of developing a webpage on our website, which is inlandlegal.org, where should just be able to go on there, find our form, submit your information, and then have someone from our team reach out. But until then, you're welcome to contact me directly here. We also just want to thank HART again for this opportunity to speak today. And through today's presentation, I want to give you a little bit of an overview on what ICLS offers, the HIV project specifically. Also, we're going to start touching on the 2025 enacted legislation. I'll give you an overview of some key pieces of legislation that were enacted this past year. And then also we'll look at some 2026 introduced legislation that is currently working through the legislature. And then there will be time for questions and answers at the end. But like Stephen mentioned, if you have any questions, please feel free to ask those along the way too. Before we get started, there's always got to be a disclaimer when legal organizations are involved. So I just want to make sure that goes on here. The contents of this presentation are for informational purposes only. No one at ICLS, including any attorney making this presentation, is rendering legal or other professional advice or opinions on specific facts or matters. The viewing and/or distribution of this presentation to any person does not constitute constitute the establishment of an attorney-client or other relationship. So I wanted to highlight 3 key laws that are just helpful as reference points as you're navigating through, and these are also just helpful to just know generally, right? The first is the California Medical Information Act, which is the CMIA. It's California Civil Code Section 56. This provides protections around private medical data, and also creates confidentiality and data storage requirements for entities that receive private medical information. So you do have the ability to protect your healthcare data. In the instance that any of that is ever disclosed, you do have remedies through laws like the CMIA here in California. So just know that that is out there as an opportunity in case something ever arises there. Also, in terms of discrimination, if you are discriminated against under a number of different characteristics, the Unrest Civil Rights Act protects you. So this is California Civil Code Section 51, and it provides non-discrimination protections to Californians based on a number of different characteristics, including but not limited to race, ethnicity, sexual orientation, gender identity, disability, and others. So there are protections as well, and you'll kind of see with this next law that it applies pretty broadly. So the Unrest Civil Rights Act also applies to businesses generally. So anytime that you are in a business, that is a law that would apply there. In addition, you also have the California Fair Employment and Housing Act, or FEHA. You can see the government code citation there as well. This establishes non-discrimination protections for Californians based on protected characteristics, much like the Unrest Civil Rights Act, that include but are not limited to race, ethnicity, sexual orientation, gender identity, and disability in housing and employment matters specifically. Some of the definitions that are used in FEHA are also used in other laws. So for instance, HIV is considered a disability in the state of California. So that is a legal protection. Generally, that is based here in FEHA that other laws will reference. So frequently they'll use the same definition, meaning that disability applies broadly as including HIV under a number of different laws in California. So just know that you have protections there. And I always like to try to highlight these just to make sure folks know about some of these key provisions as well. So let's go ahead and roll into some of the enacted laws under the 2025 legislative session. So I want to start with a few budget laws that went into place that were, I think, particularly important last year. And then we'll talk a little bit more about some of the more substantive laws that were not budget related. So AB 116 and AB 144 primarily concerned ADAP funding, and that is the AIDS Drugs Assistance Program. So this will help people purchase medication if you're not able to purchase it related to your HIV treatment. There were some federal funding cuts and some shifts in federal funds. So the state legislature last year provided a $75 million infusion into the budget to address ADAP specifically. So this new funding began July 1st, 2025. That's when the California fiscal year starts. And it will run until, I believe, June 2026 of this year, June 30th. The funding allocated specifically went to the TGI Wellness and Equity Fund, which is the Transgender and Gender Inclusive Wellness Fund, Wellness and Equity Fund for HIV preventative services. So of that $75 million, $65 million went specifically to fill in funding gaps based on shifting in federal funding. $9 million was allocated to support state and local disease intervention specialist work. So that's like county health departments and making sure that the folks on the ground have the resources they need to be able to support Californians. Under SB 105, $15 million was transferred from the Healthcare Affordability Reserve Fund to support gender-affirming care services in the California Health Benefit Exchange. There also has been a little bit of shift in terms of federal funding availability for gender-affirming care. So this bill tried to address some of those funding shortfalls to ensure that California continued to support gender-affirming care services for those who need it. So shifting out of the budget world and kind of into the more substantive legislative world, there are about 4 or 5 different laws I'm going to talk about before we get into the 2026 session. So these are all laws that were implemented and enacted, signed by the governor in 2025. So starting with AB 822, this extends the sunset repeal date for the California Commission on the State of Hate, which I believe was supposed to expire in 2027 on January 1st, but has since been extended to January 1st, 2031. The California Commission on the State of Hate effectively tracks instances against, or discrimination instances against people based on protected characteristics, including but not limited to gender identity, sexual orientation, race, disability, and genetic information. So this just provides California legislators with more of an understanding of what folks are dealing with on the ground, kind of what those numbers are dealing with, especially when it comes to discrimination.
AB 1487 renames the TGI Wellness and Equity Fund to the Two-Spirit Transgender, Gender Nonconforming, and Intersex Wellness and Equity Fund. So this is simply just a name change with this one. There were not substantive changes that were made to the structure of the fund. Basically, this just provided a recognition of Two-Spirit folks in California's LGBTQ plus communities. And it also expands the use of grants from the fund to include workforce development, development training, resettlement, and social integration programs, as well as diversion programs for youth. So there was a little bit of a shift in terms of what funding could be used for, and the legislature expanded what these funds could be used for in addition to renaming the fund. Okay, SB 590 expands California's paid leave program, paid family leave, to allow qualifying workers to take care or take leave to care for a seriously ill designated person who does not need to be related to the qualifying worker. So traditionally, under paid family leave, they had to be a direct family member, right? California recognized that there are a lot of situations where folks may be taking care of folks that they're not directly related to. So starting July 1st, 2028, the legislature expanded the paid family leave program to also allow workers to take care of a designated person who could be blood relative or not, a friend, someone you know in the community, whomever that may be. You can take time off to care for that person starting in 2028. SB 278 allows a healthcare provider to disclose identifying information without written permission from the Medi-Cal recipient to the Medi-Cal recipient's managed health plan to support HIV care improvements. And I highlight this one because generally, when you're dealing with an HIV test result, when the state has to learn of that through public health departments at the counties. So when there's a local diagnosis, the county health department has to report that to the State Department of Health and to the CDC. That's required by law. Generally, in other circumstances, for anyone to have shared that information, they have to have patient authorization, meaning your express consent saying, I approve you sharing this information with so-and-so. This, according to the legislature, caused a few hurdles in terms of potential questions around being able to share information that they felt could prevent people from being able to access the care that they needed. So in order to address that, they tried to make it a little bit easier for healthcare providers to share an HIV diagnosis, for example, without written permission from a Medi-Cal recipient to the recipient's managed plan under Medi-Cal. So this is just providing a little bit more opportunity for the healthcare providers, insurance providers, Medi-Cal to communicate a little bit better around some of that key information. Similarly, SB 504 allows a healthcare provider to disclose identifying information when reporting HIV diagnoses to local health departments to support connections with medical treatment. So again, it's for a rather narrow purpose in trying to connect folks living with HIV to a treatment service or medical service as they need it. I did want to highlight two pieces of vetoed legislation. So these passed the state legislature, but they were vetoed by Governor Newsom. AB 449 would have created a statewide media campaign to discourage discrimination based on a number of different characteristics, such as disability, gender, nationality, race, religion, and sexual orientation. The governor cited budget constraints as the primary reason for this veto. I do not recall exactly the dollar amount that would have been involved in this, but it was several $1,000,000. And the state at that time, of course, and still currently is dealing with a bit of a budget shortfall. So the governor felt that that was not something that they would be able to implement this year. AB 554 would have prohibited a health service plan or health insurer, excluding Medi-Cal, from subjecting HIV preventatives and ART, or antiretroviral treatment, approved by the FDA or CDC, to prior authorization, step therapy, and other protocol designed to delay treatment. It also would have required health service plans and health insurers to provide HIV preventatives and ART without cost sharing or utilization review requirements that can sometimes be imposed based on certain insurance plans before they allow you access to that medication. Governor Newsom cited concerns about insurance affordability as the primary reason for this veto. And to my knowledge, this bill has not been reintroduced as well. And I do not believe that AB 449 has been reintroduced this legislative session as well. So I'll pause there for a moment. Are there any questions on the enacted 2025 legislation?
Question about the veto. Questions about the veto, especially 85/4. Why would a health provider this prevented the health insurer from requiring a prior auth? And a health provider would want a prior auth for what purpose anyway? Why?
Generally cost. That's generally the primary concern.
Prior auth is a way of delaying and delay, you might save the money. So this was a patient advocacy protocol to prevent that from being a reason a person doesn't get prior, right? Advantages are.
Yes, that would include prep.
And I guess the company was saying these costs get passed on to the insurance. Therefore, I want to do a nice thing for the insurance industry.
So
Just wanted to get that on there.
well, I appreciate that question. And so it's my understanding, and based on Governor Newsom's veto letter, which is also available on the governor's website as well. So I encourage you all to take a look at that for yourselves as well. But the primary concern was insurance affordability. I think there were concerns that as insurance without prior authorization, if they all implemented this and provided it to everyone who wanted it, there would be additional costs that insurers may pass along to folks who are paying premiums, and concerns over current premium rates, I think prevented or were the primary reason, at least that the governor cited, for vetoing that piece of legislation. Thank you.
Where are you? Governor, because of this whole week, that his idea was to pass on this directly to the public services who could best promote and develop the materials for the community. Also, Advantage Plan insurers, and we being California, as additional things that so this was another kind of a political decision that kind of off balance that to create back. I'll take way back some of these.
Well, thank you for sharing that. No, I appreciate you sharing that. Are there any other questions on 2025 legislation? If not, I can move on to what bills are currently being considered that I think are particularly pertinent for people living with HIV in the 2026 session. Okay. So of course, the legislative session in 2026 is still ongoing. California has a year-round legislative calendar. So it generally starts shortly after the start of a year and will go pretty close to the end of the year holidays. So there's a lot of things that are still kind of in movement at this point. So I offer that as these bills are still all in development and still in the consideration phase. Nothing has been finalized, of course, until it has been ratified by the legislature and signed by the governor. And if the governor does veto, the legislature does have the opportunity to override that veto. Generally, it does not, but that always is an option. So starting with SB 1149. This, similar to when I believe it was SB 278 that we talked about earlier, that would allow workers to take protected bereavement leave upon death of a family member, the definition of which is being expanded to include a parent-in-law or a designated person. So kind of like where the paid family leave bill included or expanded the definition of who you could take leave for, this bill is seeking to do the same thing with bereavement leave, which I believe is guaranteed in California for workers up to, I believe, a certain day, and I do not recall exactly how many days a person gets for that. But this designated person would be defined as any person, quote, related by blood or whose association with the employee is the equivalent of a family relationship. So it provides more opportunities and flexibility for different family structures and just folks being able to take care of each other regardless of if you're blood relatives or not. This was introduced in February of this year, and its current status as of April 20th, it was placed on a suspense file in the Senate Appropriations Committee, meaning that it's awaiting further consideration by the committee. So I'll take a moment to just explain what a suspense file is, because that was something I also had to look into, and I was like, this is new. But the suspense file is basically the legislature's way of when a bill is going through committee, the legislature, if they need more time to consider, especially the fiscal impacts, or to kind of evaluate what those implications of a bill being affected might be, they will place a file on suspense, meaning it's basically just going to wait in that committee or in that particular position where it is. And then they can take it back up and reconsider it and move it along. They can decide not to address it and leave it. They can, effectively vote the legislation down. But there's still a lot of opportunity for the committee to effectively do more research, talk to more people, engage with the communities, and make sure that folks are involved in that process. So as of right now, this bill, as of April 20th, was still placed on a suspense file. So it's still in the Senate Appropriations Committee awaiting further action. SB 1023 is a bill that seeks to protect access to antiretroviral drugs, drug devices, and drug products that are medically necessary for the prevention of HIV/AIDS. So these would include things like PrEP and PEP, from being subject to prior authorization or step therapy by insurers. So this is similar to AB 554. To my knowledge, it does not go quite as far. It's a little bit more just focused on PrEP and ART treatments. So this was introduced in February of this year as well. And as of April 20th, it also is placed on a suspense file in the Senate Appropriations Committee. I believe it looks like they're looking, of course, when suspense files generally happen, they're looking at the fiscal impacts. So I think the committee is doing additional research. I have not seen that it's been placed on another hearing as of yet, but that certainly there's still a lot of time for the committee to continue to consider that piece of legislation. So one of the last bills that I'll mention is AB 1876. So this is a bill that would prohibit healthcare service plans and healthcare insurers from excluding an enrollee or policyholder from receiving a plan or policy benefits, or discriminating against a policyholder or enrollee based on their race, color, national origin, age, disability, or sex. And sex here is broadly defined. So it's defined as discrimination based on, but not limited to, any of the following characteristics. Sex characteristics, including intersex traits, pregnancy or related conditions, sexual orientation, gender identity, and sex stereotypes. So there's a broad range of protections that would fall into this bill from insurers and healthcare service plans based on any potential discrimination. So this was also introduced in early or mid-February of this year. As of April 29th, it was passed by the Assembly Appropriations Committee. So the next step would be consideration by the full state assembly. I have not seen yet, as of the last time I was able to look at this information, that they've placed it on any voting files. So, but it has been passed through the committee and is awaiting further action from the state assembly. So those are the key pieces of legislation that I wanted to highlight for you all today. I want to thank you so much for taking time again to be here and for letting me speak with you all. It's been such a pleasure. And I'm happy to answer any other questions you may have. And if you think of some later, you're also welcome to email me here. Yes.
Is the designated person, is there a requirement, a determination of what that could be? Or can you say, I have a designated person and I need to take care of that person?
So are you referring to?
Well, I was referring to that, but you
Okay.
referred to another one previously. I don't. You referred to it.
Yes. Oh, yes.
But and the other one. So,
Yes. No, great question. Thank you so much for that question. So when it comes to designated person, it's my understanding that that can just be whomever the employee designates. So you'd have a designated person you'd be able to take bereavement leave for. The paid family leave program also was implemented. So again, that does not go into effect until 2028. So there's still time for the legislature to potentially add more things to that. But as of right now, I'm not aware of any particular restrictions around designated person.
Having been somebody who took care of a family member, the person my sister that took care of, she had to qualify first, go through a number of Yeah, it's a different state, but typically, if you go through certain people categorized as being someone who needs care. And then they can designate someone else, so you want nurse to do it. That's normally the case. I'm not saying that would be the case, but in case that's probably.
Thank you.
Just like.
Thank you so much for the presentation. It seems like we have a pretty progressive government, so to speak, with all these. As voters, is there someone we should be looking up to or supporting? Do you know what I mean?
Oh, well, thank you for the question. Unfortunately, I cannot respond to that. We are a nonpartisan organization. We don't engage either side. We just are here to serve the community. So I appreciate that. Unfortunately, I can't provide an answer.
I guess I didn't really mean names, but where are these balls being pushed from? Like, I would think that we already had a lot of these in place, but apparently we didn't, or these are improvements upon other things, but I didn't mean that Democratic Party or it's interesting to me that this is happening. I'm grateful to see that.
No, absolutely. And thank you for that clarification. I am not certain exactly which groups senators or assembly persons meet with to kind of engage with those processes. Generally, what would happen is they would work with folks that either have connections to Sacramento. There are a lot of just different organizations across the state that will go and lobby for different pieces of legislation. A lot of times they'll also work with organizations within their respective districts. So that often can be the inspiration point for a lot of pieces of legislation. But as to these specific pieces of legislation that we highlighted, I'm not exactly certain if there were certain groups that proffered these or kind of how these developed, but these were just the bills that were introduced. Thank you.
Two other good questions. You mentioned earlier that HIV rates have increased in San Bernardino County. I guess this is not your department, but is there any theory on why that is occurring? In general, rates have been going down, I think, until pretty recently.
No, that is a great question. I have not seen any data indicating one particular reason for that, or even some of those particular reasons. I think there's still a lot of research to try to address what is causing this increase, because generally across the nation, HIV rates have gone down. And that's something that we've kind of seen uniformly. There are certain places where HIV diagnosis rates have fluctuated a bit, and sometimes they do increase. But I don't think that within San Bernardino County or Riverside County, I have seen anything that's pointed specifically to certain conditions that are causing that increase.
Yeah, I can speak to that a little bit, I think. So Riverside County has more resources to devote to prevention than San Bernardino does. And also San Bernardino is a much more diverse and rural. And so those folks are getting first treatment. So that's a real problem as people are living that way and no access. As you know, do a good job of letting people know about PrEP and because you and all those good things outside the region here. So that's a major issue.
Thank you. And I'll also add to that too, PrEP uptake rates across the nation have been relatively low. So we've seen, even though, if taken as prescribed, PrEP can be up to 99% effective in clinical trials. There still, I think, is some hesitation for uptake for a lot of different reasons. Sometimes folks don't know that that's available. Sometimes they're worried about their ability to afford it or access it. Sometimes there's stigma around being on PrEP. And so there, I think, are a lot of different concerns that also impact folks getting onto PrEP and accessing PrEP and PEP.
I have a little bit. Our state reps, Wallace and Ochoa, you can look them up and see how they're voting on these bills and see what their positions are on our community. One is a little more open than the other one. This is a big problem that happened with the B district. So please pay attention in this election, wherever you stand. there is a really difference between the two of them. And you can look it up, you know, they have everything and you know, how they're voting and what their positions.
So, while we're being political, I'd say that for the representative race in our county, you know, we recently got redistricted out of Ken Calvert's county into Daryl Issa. You know, we're somehow connected with North County, San Diego for some reason, situation gerrymandering. But as a result, Issa is not running for re-election. So that race is open. My friends in San Diego tell me that Marty Van Wilpert, who's yeah, you've been seeing her in your mailboxes a lot recently. Used to be in the Peace Corps. They said she's very friendly to the HIV community, and that's who they are supporting. So take that for what it's worth. That's what they've been hearing.
I'm only speaking about California representatives. Those are Congress.
Exactly.
Yeah, so Ochoa and Wallace are who represent our area.
Yeah.
They're both Republican.
Is there any accounting for COVID behaviors or any type of COVID data for say increases in infection rates or because some of your slides reference that 2-year gap and it seems to me that would be COVID times. So I just think COVID brain, COVID inoculations, whatever you believe in, COVID behaviors, you know, the whole world thinking we might die. And well, I mean, it happened and it happened very recently. So I'm just curious as to if that could have increased some infection rates or even limited the access to prevention type condoms, whatever, you know, because you couldn't go out. So thank you.
Well, thank you for that question. I think that definitely could be a factor in some of those numbers that we saw. But I think the last part of your question really kind of sums it up, which is the access to a lot of these healthcare services, you know, was largely shut down. There was a lot of scarcity of healthcare access to essential services like PrEP and other preventative. So that's certainly possible that COVID, not only because of the broader public engagement, I suppose, like around behaviors related to like the COVID pandemic, but generally also just some of the healthcare responses to the pandemic, trying to focus resources on people who contracted COVID. I think certainly spread the healthcare sector very thin, and I think that certainly could be one aspect of that change in HIV diagnosis rates during that time.
Yeah, that's absolutely right. Do the monthly calls with the California Office of AIDS, and they reported on that there was no access. Everything got shut down. But surprisingly, people did not have stuff access. People did too, and that they saw a great increase in STIs across the board. And people were and holding up with you know, their own little pods that they were creating that getting them access to. So it's what I to.
Yeah, you mentioned ADAP funding earlier. With the federal government decreasing ADAP funding, did the state fill it in? Are there restrictions now for people in the state? And what will happen in the 26th year? Do you have any idea? Because I know some states are restricting who gets access now. So it's a real problem.
Absolutely. And thank you for that question. Yeah, you all may have seen that some states have changed or tried to change certain aspects of who may qualify for ADAP and the funding generally around ADAP. To my knowledge, one state that did this or tried to do this was Florida. They, to my knowledge, have reversed course and have decided not to move forward with that. So I think it seems broadly that in California, the funding was meant to try to replace that federal funding as much as they could with that infusion of $65 million, $75 million through the budget last year. This year, it's going to be a little difficult to tell because there also are federal budget considerations that have been proposed that would substantially reduce funding for programs like ADAP. But again, that has to be considered by Congress. Congress, to my knowledge, has not directly acted on any of those matters just yet. So there's still a lot of possibility that funding may change. But as far as I'm aware, as of right now, there's been no legislation in California that impacts access to ADAP. It should continue to be available at the levels it's been available in the past.
Yeah, Florida tried to do it first. They went from, I believe, $68,000 as an income threshold down to 21,
Right.
thereby eliminating a lot of the people from being covered. But there was such an uproar over it that they took it back.
Advocacy workers.
Advocacy wins. That's right. That's why it's really important that if you don't like something, that we do stand up and say something about it. And then we do contact our representatives.
Great. Any other
Just
questions?
a plug for the Facebook group. We can't do a lot of nonprofits, and certainly their group can't do a lot of partisan advocacy work. But we do have the Virtual Village, and that's a private Facebook group, and people are free to share whatever they want, their recommendations, who to vote for, who to protest against, so that sort of thing. So if you're not on there, and if you're interested in this, please post liberally and let people know. And that's a group of really engaged people, both in Palm Springs and all over the country, so we can share that with each other.
Yeah, thanks, Doug. All right. Thank you everyone so much. Levi, thank you so much. Don't forget, we got Big Mama's, Not Your Mama's Bingo on Sunday at the 111 bar. Grab some friends and come on out. Thanks everyone for coming tonight.
Yeah. That was taken. Is the 14th the next week?